Welcome back, everyone. Today, we will discuss a very important topic, issues related to sinuses and respiratory health. These issues not only cause discomfort, but also seriously affect your daily life quality, making you feel fatigued and decreasing your ability to focus. However, if we understand the root causes of these problems and apply effective remedies, you can significantly improve your respiratory health. They made me silent. Barbara O'Neill's banned method for respiratory healing.
Now, we always called it sore throat. Now it's called strep throat, apparently. It's still a sore throat. And then coming down, it could be even just a simple cold, but coming down to bronchitis, tonsillitis, even asthma, pneumonia. These are all problems that are happening in the respiratory. And so where's my why? And there is always a reason. Why do these problems happen? Well, let me begin with the common cold. So in the 1940s in Salisbury, London, the Common Cold Research Unit was set up to find the cause and the cure of the common cold. They would get people, they'd put them in a hot bath, then take them out and put them in the cold air, but they didn't get a cold. And then they'd get the people and they'd put them in a hot bath and they'd scrape the throat of someone that had a cold and put that in the person in the hot bath and then put them out in the cold air, and they didn't get a cold. In fact, after 40 years, they closed down in disgrace, really, because of the total inability to find the cause and the cure of the common cold. And they never will, because a cold is a house clean. It's just a house clean. And a friend of mine, his name's Gary Martin, he was the health director at Living Valley Springs Retreat in Australia for many years. He said that he found with a lot of cancer patients there were two common denominators. One, they never get colds, and two, they don't drink water. Now, when you're cleaning your car, what do you use? Water. When you're cleaning your dishes, water. The body, water. So because they weren't getting a regular house clean with daily water, and because they weren't getting regular colds, waste was building up in the body. And the waste build-up in the body was a contributing factor to laying the groundwork of cancer. Interesting. So when you have a cold, you're blowing your nose, coughing up, what's all that? It's waste. It's the body getting rid of waste. I mentioned earlier in the week our lymphatic system. And our lymphatic system sweeps away waste from the tissues and it throws the waste into our respiratory. So the largest lymphatic organ is the tonsils, remember that? So I've been struggling with a little bit of a sore throat, so I've been having a lot of garlic and a lot of cayenne pepper, and I must do the running up and down the hills in the morning. Well, that hill near the gorge, you don't have to run. You just walk fast and you get high intensity. Oh, so excited this morning. I coughed up 4 lumps. Where's that coming from? It's from my tonsils. I know it's from my tonsils because I'm not coughing here. It's just coming from my throat. And so when I go home, I do oil pulling, which is olive swishing around 10 times and then release it out, either in you call it a trash can, or you don't call it plug hole. Don't put it down the plug hole, the sink, you call it sinkhole, because coconut oil, when it goes hard, what happens? Solid. Don't put it down the drain or you'll be in trouble. And often after that, there's a cough up, because what it's doing, the name's called oil pulling. It's coconut oil in the mouth and you swish and you're pulling waste from in the lungs, you're pulling waste from the tonsils, you're pulling waste from the sinuses. You're also pulling waste from the tongue. You're pulling waste from the glands under the tongue. Waste is being pulled from the blood vessels under the tongue. That's why it's called oil pulling. And Bruce Fife, F-I-F-E, he's written a whole book on it. One wonders how he could write a whole book on oil pulling, but he has. And he shows that just this simple thing, I've only known about it for about 10 years, but apparently it's been quite common all through Asia, is oil pulling as a simple little way of just pulling waste out of these areas. So if you have a cold, if you have a sinus, if you have any chest, a part of what you do to the body to bring about healing can be oil pulling. Now, because I travel a lot and sometimes I'm not breathing in the breast air, especially when I'm on planes a lot, I regularly oil pull. And I'm amazed when I oil pull that I'll often cough up a lump. And you know what I think? If I didn't oil pull, where would that lump stay? And if I didn't go up the big hills and down in the morning and I didn't cough up that lump, where would it stay? Well, I'd have to get more of a cold, because that's what a cold is. It's a house clean. And if you give the body the right conditions when the house clean comes, it can actually go through your body very quickly. Maybe in a couple of days, and you'll be right.
One reason people experience excessive mucus in their respiratory system is due to allergies, which can be triggered by exposure to chemicals or mold. It's important to check your home to ensure there is no mold, as it is a toxin that can cause allergies. Food allergies can also be a cause. The key is to become a detective and find out why you're producing so much mucus. When you have a cold, you'll have mucus, and if it spreads to the chest, you may have a persistent cough, sometimes lasting up to 3 weeks, which is normal. A mother said her child had been coughing for 2 weeks, and Barbara O'Neill would say that it's normal. Let your body clean itself, and don't worry when you cough up phlegm, because it is something the body needs to do to keep you healthy. Our respiratory system, just like hybridized wheat, has undergone unnatural changes. In the 1950s, the hybridization of wheat created structures that never existed in nature before, and this has made it difficult for some people to digest. While they may not have noticeable symptoms every day, one sign of wheat allergy is excess mucus. One of the allergens could be lectin in oats, a plant chemical that can cause inflammation if it enters the bloodstream. So, if someone is allergic to oats, it's best to remove them from the diet. When allergy symptoms disappear and the body returns to normal, they may be able to try a small amount again. But if mucus appears after eating oats, it's a sign that the body is reacting. In this case, the body will naturally look for alternatives like millet, rice, or other foods. Peanuts can also be an allergy cause due to mold contamination, so peanuts should be stored properly. Refined sugar acts like gasoline on a fire, increasing the severity of any illness.
When I was at Misty Mountain a few years ago, we had a nurse who was an ear, nose and throat specialist nurse. So what she does, she assists the surgeons and the doctors that are treating sinus. So they do a lot of sinus operations to clear out the sinus. She said, you wouldn't believe the green slime that we pull out of sinuses. And she said, and every specialist acknowledge is that it's fungus. So then my question is, well, why is it there? And then I was reading, and I think I've quoted this in my book, that in the 1990s, a group of doctors in the Mayo Clinic declared through their research that sinus was fungus. So why is it there? That's what I want to know. Why is it there? Well, when you get someone that's got an allergy to these foods and there's common excess mucus building up in that area, then the microorganisms evolve into or change roles into a cleanup. That's called yeast and fungus. That's what they do. They clean up the area. But because the allergens continue and the mucus continues, the fungus, the yeast have a continual food supply there. And so they go and get all of it cleaned out. And by the way, because they're having to breathe through their mouth, then the little canals at the back of their nose are getting smaller and smaller. And so then the next option is to have it drilled out. Yes, it's true. It does happen.
Today, we see that there are effective alternative methods for treating allergies, such as clearing sinuses, shrinking tonsils, and improving respiratory issues. So, is using nutritional yeast safe?
I don't use it at all. You can't kill yeast. And there are so many people that I meet today who major or minor have some sort of yeast problem happening. Typical is the nails. They should look like that, look like a nail. One man was so excited about the change in his nails after changing his lifestyle, changing his diet, he sent me a photograph of his big toenail. And it was coming through perfectly clear, and the top was all lumpy and gnarly still. He was just so excited about his toenails. So nutritional yeast is not something that I use to make food taste magnificent. I use fresh herbs. So when I go to Holland, the people I stay with there, I always do the cooking. And in 1 week, I use up the herb supply that they use for a whole year. You got to put a lot of herbs in, and that makes it taste magnificent, and good quality salts and good quality oils. That's what makes food taste nice. And I think a lot of people that have come off eating and going over to vegetarianism, looking at the legumes, I mean, you cook a steak, you cook a chicken, it's just flavoursome. You cook lentils, no flavour. You got to do something. It's like tofu, it's a tasteless sponge. You got to do something. I put ginger and garlic and herbs and lemon and oil and salt, let it marinate for a couple of days. Amazing. I say, if your tofu doesn't taste nice, it's your fault for not putting enough flavour. Flavour in it. Don't go lightly on the flavourings, you know. It gives a real nice punch. And so I'd like to give you a story of a lady that came to with sinus problem. It's quite an extreme story. She was 32. She was overweight. And she said, my main problems are sinus. She said, I have daily headaches. The pain is so much. So always mouth breather. Being a mouth breather, she's not getting oxygen into her cells. So you know what she's just been diagnosed with? Chronic fatigue syndrome. Can you see the diagnosis comes, but there's no assessment of why or what can be done about it? And I know in Australia with Medicare, the doctor's only allowed to spend 15 minutes with you. How much can you find out in 15 minutes? And that's why I believe each one of us should be our own doctor.
Barbara O'Neill mentioned several powerful herbs that can support treating sinus issues, one of them being golden seal. Another great method for curing sinuses is using gold powder and sill, an inhalant that helps cleanse the sinuses. While you may stop eating certain foods, sometimes people have accumulated this problem for 10, 20, or even 30 years.
Get a herb. This is quite a remarkable herb. It's an expensive herb. We can't get it in Australia, so every time I come to America, my staff say, please bring some golden seal back with you. And when I get into Australia, we get it as the powder. So when I get into Australia, I have to declare everything, so I write herbs. Now, did you know in Sydney Airport, you can't fly in before 6 a.m. and you can't fly out after 11 p.m. So at 6 o'clock, you've got about 10 planes from all over the world all landing. So the Aussie immigration, they're moving you through quick. And they come up and say, what do you got? Herbs. What are you going to do with the herbs? Make a herb tea, I'll go through. And we do make a herb tea with some golden seal. But what if you can get the golden seal powder? Golden seal is called king of tonics to all mucous membranes. And all your respiratory is lined with mucous membranes. So it has a tonic effect. But something else very interesting about golden seal, it's a huge or a broad range antimicrobial. It's antifungal, anti-yeast, antibacterial, anti-staphylococcic. Did you hear that? There's not a drug that will kill staph, golden staph, but this herb will. So we get people to sniff it. Now, did you know when you make a fist, you've got a little dip right there, and it's called the snuff dip. And they used to put snuff in there and you'd sniff it. Well, that's what you do with the golden seal powder. Sniff it up into the sinuses. Don't go, or it'll feel like the top of your head's about to blow off. Just little sniffs. Just do a little sniff. So that's what we got this lady to do. Twice a day she would sniff up. She said to me after a couple of days, she said, Barbara, it's like I'm blowing green barley out of my nose. So this lady went home a very happy lady. She had direction. She now knew which way to go. I didn't hear anything. 2 years later, a lady came to do our program. She said, you don't remember me, do you? I said, I'm trying. She was that lady. She'd lost 10 kilos, which is 20 pounds. She looked great. She said, I've got a great story for you. She said, I have had no headaches for 2 years. See, their headaches were due to the build-up in her sinuses. She said, I don't have sinus problems anymore. Yes, I did blow out green slime for about a month. She was a mouth breather because it was just so blocked up. The best way, if you're blocked up, is to blow your nose, and if your mouth tries to open, tape it up. And you will, as you breathe through your nose, you will open the nostrils.
Avoiding allergens is the first step, but there is so much more you can do. One of those things is breathing. Barbara O'Neill will show you a nasal breathing technique, which is especially helpful for those who have chest-related breathing problems, particularly for people with bronchitis or asthma. Professor Budo discovered that when you breathe through your nose, you maintain the correct carbon dioxide levels in your blood, helping you absorb oxygen more effectively. He also mentioned that carbon dioxide helps dilate the bronchi, opening the small airways in the respiratory system. When someone has asthma, their bronchi swell, causing difficulty breathing. Typically, bronchodilator medications like Ventolin open the airways, but in reality, patients just need to hold their breath for a little while to increase the carbon dioxide level in the body, which relaxes smooth muscle and helps open the bronchi. This may seem counterintuitive because during an asthma attack, patients often feel fearful due to the sensation of not getting enough air. However, holding the breath increases carbon dioxide, which helps relax the muscles around the bronchi and allows the patient to breathe more easily. Modern research has shown that this breathing technique can be an effective way to control asthma attacks without the need for medication. Additionally, if you have a cold, resting adequately and eating lightly is crucial for helping the body recover. Also, mild exposure to cold, such as climbing a mountain, can help trigger a natural response in the body, releasing cold shock proteins that enhance the immune system. These proteins help the body fight infections and improve recovery. However, this should be done carefully and in accordance with your health condition. When dealing with a cold or respiratory issues, Dr. O'Neill also uses a mixture called the flu bomb, which includes ingredients like garlic, ginger, turmeric, eucalyptus, lemon, and a bit of hot water. This is a natural antibiotic that helps the body fight respiratory issues and cleanse the airways, instead of using antibiotics. This method not only helps treat quickly but also supports boosting the immune system, allowing the body to recover effectively without the use of conventional medications. I hope the information shared today about sinuses and respiratory health helps you improve your respiratory health. If you have any questions or experiences to share, feel free to comment below. Don't forget to like the video, subscribe to the channel, and turn on notifications so you don't miss out on future health tips. See you in the next video.